Thank you for joining. We're going to get started in the next minute or so. We just want to give everybody an opportunity to log in and have access before we go ahead and get started.
Okay, we're going to go ahead and get started. So thank you for joining our CPSDA educational webinar today. Today's presentation is titled Athlete-Centered Care, Establishing a Framework for Successful Behavior Change. CPSDA's premier partner, Cheribund, is sponsoring this educational webinar. I'm Brett Singer, and I'll be playing the role of moderator today. Now I'd like to introduce our speakers. So Anastasia Kaspenjuk has worked with a wide range of individuals, from those with cardiovascular disease at Cleveland Clinic Heart and Vascular Institute to collegiate athletes as a sports dietitian for Oregon State University Athletics. She has experience working for a biotech startup company, which has used a systems approach to provide individualized health and wellness to members based on biometric data. Stacy started her own business, Enrich Health, which provides remote nutrition coaching and consulting services. She also works part-time for Genev, a startup company which focuses on supporting women during menopause through exercise, nutrition, and lifestyle strategies combined with telehealth offerings. Lastly, Stacy teaches kinesiology, exercise science, and nutrition courses for Oregon State University and Eastern Oregon University. Next, I want to introduce Fred Tedeschi. He was appointed Director of Athletic Training Services at Oregon State University in 2014. Fred arrived on the OSU campus after 16 years of head athletic trainer for the Chicago Bulls of the NBA. While with the Bulls, he was twice selected for the Joe O'Toole NBA Athletic Trainer Association Athletic Trainer of the Year. He had a six-year stint as a board member for the NBA TA and was the organization's chairman for the 2005 and 2006 season. Prior to his lengthy tenure with the Bulls, he served as the head athletic trainer at the University of California from 1994 to 1998 and at Vanderbilt University from 1991 to 1994. He's also experienced as an athletic trainer for 7 years with the San Francisco 49ers and as an athletic trainer for the 1 year for the United States Volleyball Association. Fred holds several professional certifications and is a current member of the NBA TA, the Illinois Athletic Trainers Association, and the NATA as well. He also has published several sports medicine studies. Now I want to also say thank you to our partners at Cheribund. I'd like to introduce Dan Sager, who is the Director of Team Development and Nutrition. Welcome, Dan.
Thanks, Brett. As he said, my name is Dan Sagers. I'm the Director of Team Development for Cheribund. I have the good pleasure of working with many of you guys throughout the year. For those that don't, Cheribund is a producer of all natural, not from concentrate tart cherry juice products. We've been a sponsor of CPSDA since 2010 and a premier sponsor for the last 2 years, and we're going to continue that premier sponsorship well into the future. So looking forward to continue working with you guys. Please let me know if there's ever anything we can do for you, and enjoy the webinar today. Thank you.
Thanks, Dan. So let's discuss a few logistics for the call. All your phone and computer lines are muted and will remain muted for the duration of the call. If you have a question, please submit your questions under the Questions tab as part of the control panel on your screen. I will moderate the questions and ask them to our panelists as the conversation flows. I may also answer your questions by typing a response. So with that, we'll go ahead and begin the webinar for today.
Right. All right, thank you all for joining with this webinar on athlete-centered care, and it really is establishing a framework. So want to make that mention. This is a starting point around this topic, and hopefully this can provide you with some steps moving forward on how to advance your practice and support the athletes, patients, and clients that you work with. So neither Fred or I have anything to disclose. And just on the introductions, in addition to what Brett shared on our background, as Brett mentioned, I have experience as working in the academic realm, athletics, and more recently, biotech, telehealth startups, and as an entrepreneur. Through all of these areas of my career that I've worked in so far, one thing that has been distinct related to both my education as a registered dietitian and sports dietitian specifically, as well as working with the individuals, is this commonality around changing behaviors and coming to learn that it is a process that deserves a shift in how we think about this. And one area that I was able to really dig deeper into this was when I worked in athletics at Oregon State University and had the opportunity when Fred was there, or when I was working with Fred as he came on as the director of athletic training services, to collaborate with the athletic trainers, and such an important role as dietitians. Many of you know, many of you are in roles where you are the only one in that position, and collaboration is key. So I am very grateful for Fred providing that opportunity for me to bring to his staff at the time this idea around motivational interviewing and behavior change science, and how we could use that collaboratively in each of our own areas of expertise to support the athletes that we are working with. So that was how Fred and I came to work together, and that collaboration has built since then over the years. And I've been able to build on that in the different areas I've had the opportunities to work as my career has evolved. One thing I'll note here, we're going to talk a lot today about strengths, how we can identify our own and how we can identify strengths in others and use that to support healthy change, whether it be around nutrition or other health behaviors you may be working with your population on. And my signature strength from a survey called the VIA survey, again, we'll talk about this throughout the presentation, is honesty. And I feel that that does reign true for me. Honesty is definitely something that I value and bring to the work that I do with others and within my own personal connections and relationships. So I'm going to turn it over to Fred from here, and he'll provide a little bit more on his introduction.
Great, Stacy. Thank you very much. And I guess just off the top, would like to just thank the CPSDA and Cheribund for having us here today. It's really an honor to be able to present on this topic. So as Brett had said, yeah, I had a long tenure as an athletic trainer in multiple settings in professional sports and in college athletics. To the point where it sounds like I've been at it for a long time. So looks like my next experience is going to be on the retirement front. So kind of looking forward to that. And, Stacy said we are going to talk about strengths a lot as we move through this. And time and time again, as I've taken the VIA strength survey, gratitude always comes up as one of my top 5. And I see that in my life every day. I'm very grateful for what I have and the people that I've worked with and the family that I have. And I really try and express that gratitude. And that really is kind of what propels me going forward. So I always kind of look toward that strength, to really kind of leverage and, live my life. So Stacy, if you'd advance it one. So the objectives for today's talk are to understand the practical strategies for developing rapport with athletes using empathy and the respecting of their autonomy. Second, we're going to provide examples of effective motivational interviewing techniques for behavior change within the athletic setting, but specific to dietitians. Identify common roadblocks to implementing these strategies in athletics, and suggest creative approaches to overcome these. So we're going to try and address each of those 3 as we move forward here. So Stacy. So the first poll question, Stacy, do you want to ask it real quick?
This Amy should be able to pull this up. So this one will come up, and this is specifically thinking about your experience with motivational interviewing. We'd love to just get an idea on from you as the audience, where do you use motivational interviewing? Do you use motivational interviewing? And get an idea of your experience around that. Okay, so looking the results.
So we'll kind of plot on there. I think that's awesome to see that well over 90% of you have some exposure, or at least are using motivational interviewing in your work. So a lot of this will look familiar to you, but hopefully we can highlight some things that maybe you can take away and bring to your setting. So if you would advance it there, Stacy, if you can.
There we go.
All right, so what I thought I would do is kind of cover some of the overview of current sport coaching. Again, I think we're at a time for some real change, but I think if I was to describe it throughout my career and what I've seen is that it's an autocratic at almost every level I've been at. The head coach is clearly at the center of all things and kind of ruling from that position of power. Most do it very well, some don't do it very well at all, and it does get in the way of really trying to apply some evidence-based strategies. The interesting thing about it is most sport coaches have little or no preparation or training on the academic side of how to deal with behavior change, how to deal with many of the soft skills, as people refer to them, leadership, budget management, and all those things. So most places do require a bachelor's degree. Some may require first aid and CPR. I think you're seeing that more as the norm. Additionally, I think you'll see individual institutions may require some diversity training, training around sexual harassment and sports safety, which is a great thing because that didn't exist in 5 or 7 years ago. I thought I'd talk a little bit about sport coaching versus kind of coaching. Again, we talk about the sport coach, how they kind of dictate from a position of power, and you superimpose that to kind of what Stacy and I have come to talk about coaching, that is supporting autonomy, that is trying to identify strengths and partnering with people. And I think there's some data that's emerging that really supports that coaching mindset versus kind of that autocratic sport coach thing. I'll leave it. And again, I think the overriding thing is you have sport coaches that probably moved forward and moved through, and it'll depend, but generally speaking, their main qualification is they played the game, most played it at a high level, and that's what, and their natural progression was into a coaching role. So I thought I'd contrast the sport coaching at the professional level and the college level. So at the college level, you have sport coaches that for the most part control all aspects of the program, from personnel to playing time to budget, and there's not much in the way of a person to check that with. Some places will have sports supervision, some places do it well, some places don't do it very well. The interesting thing is that at the professional level, you'll usually have a GM and a head coach that are kind of on the same level. At times it's very conflicted. There'll be disagreements, but at least there's room for some collaboration there, and that the coach that is sort of tied to winning tomorrow's game has a person to rely on that has a long-term vision. So I think that becomes important when you're talking about how to run a stable, balanced program. So Stacy, if you would advance. So at the college level, we've seen the NC2A, I feel like they've stepped up in the last 3 or 4 years to try and kind of not mute the autonomy of the coach, but also more transfer some empower student athletes to kind of control things. And I think there's been a couple of areas where I think they've made some real impacts. One is on mental health. We know 25% of student athletes will have some sort of either depression, anxiety, or other mental health challenge. Roughly 10% is the data that will seek help for those things. So I think recognizing that the NC2A has sort of did this mental health initiative, mandating mental health emergency action plans, mandating that trained personnel are available to student athletes, all with the idea of making sure we're addressing the student athlete and their needs first and foremost. You also seen the NC2A relax the transfer rules so that a student athlete can really enter a transfer portal at any time and move around a little bit. While that kind of goes against the academic mission a little bit, I think, but it does empower the student athlete to have some control over where they want to apply their experience. Within the last year, the NC2A has done a lot around catastrophic injury prevention. There's been a number of guidelines and not quite position statements that have talked about things that need to be put in place to ensure sport safety and safety of student athletes. I think some coaching behaviors have been called out there that were less than optimum. A couple of the recommendations that came out of that were to align sports performance and sports medicine, again, identifying safety as a primary thing as opposed to sports performance aligned with a coach that will maybe kind of get them off the evidence-based path. And the other part of it is just common sense sort of stuff, mandating scheduling breaks and kind of having a flow to a year. And then the last one I would sort of mention is that around time demands, they've kind of looked at a schedule and you can't be all on all the time, that there's some ebbs and flows. You have a number of hours per week that a student athlete can be engaged in their sport, but also made coaches publish in advance days that they were going to practice. So student athletes could identify those times and be able to sort of have a life outside of athletics, which I think most of them desire. For a lot of coaches, this is difficult because they would like to try and hold that over to the night before and identify the time for practice the next day. Again, not optimum if you're a student athlete. And again, all this is trying to balance both the student and the athlete side. So I give some credit to the NC2A for what they've tried to do. And a number of these initiatives, I think, are trying to promote student athlete autonomy. So advance it, Stacy. So I would this came out in November of last year. And if you all work at the collegiate level, if you've not read this, it's available online. It's called the Drake Report. Basically, it was written by academicians as well as people that were involved in athletics. I found it, based on my experience, to be very accurate and very on point. Called out the academic fraud that exists, some at low level. Some places do it really poorly, telling kids they have to take this major and some of the support there. So the other thing that got called out in this report was the lack of coaching preparation, which I think we can all identify, or at least I've seen in a number of places, that there's gaps in their education. And the other thing it really called out was the alignment of strength and conditioning with sport coaching, and a way to try and get that separated out. So with all of this, I would say you really can't legislate common sense, but I think that's kind of where we've found that initiatives have to come into place so that things are balanced in a better way. So advance the slide. So just to kind of talk about some of my journey, when I got to Oregon State, I really didn't have a lot of background in all these things. So Stacy was one of the first people that brought motivational interviewing to the forefront, as well as my daughter, who's mentioned down below. But interestingly, the first time she brought it to me, I kind of shook my head and like, what are you talking about? And then come to find out that there really is some science and evidence to support its use in promoting the autonomy, using empathy, identifying which stage people are at in terms of their change. So I give Stacy a lot of credit for making me aware of it, but also in the collaboration that we've had in bringing it to our staff. And even now at Oregon State, we continue to kind of make inroads with strength and conditioning, our academic staff, as well as got some interest from sport coaches. So I think that's really cool. The other person, just to highlight, Todd Gibbs was at Oregon State for a number of years. He was in our prevention unit in student health services, and introduced me to wellness coaching, which I've subsequently take a number of trainings in. And again, it embodies a lot of the motivational interviewing, but how to have rich conversations, how to be empathetic, how to really support autonomy. So Todd has really been a meaningful person in my life that has really taught me kind of a better way of having conversation, and it's allowed me to use identified gratitude and how I can use that going forward. And then my daughter, Kelly, who's got a master's in elementary school education, again, brought motivational interviewing. She gave me the book, but also brought the idea of trauma-informed care, which again, empathy and supporting strength and autonomy are kind of the hallmarks of that training. So I guess I'll conclude my little portion that if I knew then what I know now, boy, I can look back on my career and how I lost opportunities to gain better rapport, to gain compliance by being the expert. As a medical professional, I would always kind of feel like, hey, you're coming to me for information. Here's how you have to do it. If you don't do it right, you're not going to get the desired results. So I was really autocratic. I was very much again not supporting autonomy, not being empathetic. So now giving student athletes or athletes a choice. What would you like to do? How would you like to manage? And really kind of identifying where they're at in the stage of behavior change. I think I could have been a whole lot better at what I do had I known all this then. So sounds like a regret. It's really not. I'm really grateful for what I've been able to acquire thanks to Stacy, Todd, my daughter, and as well as my staff. So if you want to advance the slide, Stacy, and go ahead and take it from here.
All right, so a little bit on my journey. Thank you, Fred, for setting that framework and again, highlighting that collaboration, which is so important in the work that we all do. So for me, working in academics and being trained academically, as I assume all of us are, we learn the research, we learn the science, we understand what things work based off of the research, and we're taught to provide these recommendations with the intention that we want to help. We want to help people to perform, we want to help them succeed, whatever their goals may be. And when I stepped into the athletic realm as a sports dietitian at Oregon State University, I had this idea of, okay, I just need to tell these athletes what to do. Then they're going to want to do that. And for the most part, there was a lot of individuals that did say, just tell me what to do, just give me that plan and I'll go do it. And what I learned in the process of providing that plan and telling people what to do, even the most well-intended individuals struggled with follow through. And this really intrigued me, thinking about, okay, what is it about this? How there has to be something else here. And that's where I started digging more into learning about this idea of behavior change and where motivational interviewing comes in. And then after having the opportunity to work in a biotech startup company that really focused on using behavior change science combined with data to help people achieve their goals, I dug a little bit deeper. So it's been continued practice and training. It is always a continued practice and training. I think all of us know that we are always, once we learn something, we're eager to learn more. And that's one of the great things about the field we work in. There's always more to learn. So today I want to share a little bit about that practice and how you can start bringing it into the work that you do based off of my experience, things I've learned, and things that I still have to learn. So to start with, we have another poll question about some of your behaviors and how you view them. And so I'm going to have Amy launch that question. And Fred, if you can see the results, I am not able to see the results. So if you're able to share those, that would be great. And if there's a way for me to see them, if someone could let me know, that would be great too.
So Stacy, looks like 65% brush their teeth daily, 3% exercise on a regular basis, 6% eat vegetables, 15% take a shower, and 12% wake up when your alarm goes off.
All right, awesome. So all different levels of degrees of what behaviors you do with little to no thinking that are just more that automatic behavior. So this really goes to, where does that motivation come from? And so reflecting on that behavior you chose, or perhaps you have another behavior that is fairly automatic for you, I encourage you to think about what motivates you to do that and how did it become so automatic for you. Thinking about athletes, I remember when I worked in athletics, and I would tell people a lot of times, they would say, that must be great to work with a population that's so motivated. They must just do whatever you say, and they just go out and do it. And I thought that was interesting, right? There's this perspective of an athlete being automatically motivated to do what they want to do. And they are certainly motivated with some things. We all have certain levels of motivation to do certain behaviors. The key is, what is extrinsic motivation versus that intrinsic? And there's a place for that extrinsic motivation where you are motivated to do something because of an external factor. So in the case of athletes, a lot of times their motivation extrinsically is going to be from perhaps fear of punishment, or because they know a coach is holding them accountable. What we want to move more towards is helping individuals find that more intrinsic motivation so that it becomes more automatic, so that it becomes something that you're doing because you want to do it for yourself. And, thinking of the brushing your teeth example, which most of you chose, there is this brushing our teeth does become automatic. It's a part of most of our routine. And if you think back, perhaps if you remember when you first learned to brush your teeth, or perhaps your parents could share, it may not have been that intrinsically motivated when you first learned at 3, 4, whatever the age may be. There may have been rewards for brushing your teeth. There may have been consequences for not brushing your teeth. So that system was set up for you, but then down the line, you learned the benefits of brushing your teeth, and now the benefits may outweigh the consequences to you. Brushing your teeth, healthy teeth and gums, less trips to the dentist's office, less out-of-pocket medical costs, and so forth. So there's a balance there. And so thinking about that behavior as an example, or others that you may consider, I think it's important to recognize that changing behaviors is hard, it's individual, and focusing on what the motivation is for that individual is key to helping them on their journey for behavior change. So going back to what Fred had discussed in terms of what the current athletic culture is. Often we do see this lecturing, confronting, coercing, sometimes threatening, or this use of the righting reflex. And this can come from we've talked a lot about head coaches and strength and conditioning coaches. It can also be in other forms. It certainly could be from assistant coaches and even in our own realms of athletic trainers or dietitians, where we may be doing more of this lecturing, talking to, and this urge to do this righting reflex, which is a situation where an athlete may be doing something in a certain way, and we have this instinct to want to fix it. We want to fix it. We want to make it right. So if, for example, an athlete is struggling to get the recovery nutrition they need, we have this urge to say, here, just have this protein shake after your workouts. Here you go. I'll make it for you. You take it, and they're on their way. Let me take care of that for you. And where that can be a short-term fix, it doesn't provide that long-term sustainability and solution to really support the athlete in finding that intrinsic motivation and supporting themselves in their changing behaviors. And looking at a study that was published in 2017, I specifically looked at elite soccer players. And when this environment was presented around lecturing, confronting, coercing, threatening, and using that righting reflex, what they found is that the athletes reported an increased frustration around not meeting their needs. So they felt their basic needs weren't being met. And if those basic needs aren't being met, then it can be difficult to do other things that place higher demands, so performing athletically being one of those. And there also were these maladaptive outcomes, so an increase in things like eating disorders, burnout, and different physical symptoms, which we all know is obviously going to impact performance. And one other thing that was interesting with this environment, there was a perturbed psychological arousal prior to training. So that readiness to train was disrupted. So the athlete showing up to training, showing up to competition was in a suboptimal state of arousal for performance. So this shift, because of the culture that is here, that has been presented with, and many of us have worked in or currently working in, can take time, patience on your part as the practitioner, lots of curiosity on what is happening here, why does it exist, and being thoughtful in your approaches. The one thing, and perhaps most important, I would encourage the persistence, not to give up, and there are ways to make this shift in ways that work for you and the setting that you're in. So as a sports dietitian, some highlights right here. If you don't walk away with anything else, these are some things to remember that you can always go to focusing on the athlete's strength. What are their strengths as an individual, and perhaps their strengths as an athlete that may be able to pull on and lean on those to help them in changing behaviors to benefit them. The empathy and the autonomy, like Fred has mentioned, these things are truly key. And if you only focus on two aspects of motivational interviewing, we'd encourage you to focus on these. Developing rapport, I list this here, but know many of you as colleagues, as sports dietitians, and really feel that this is a strength of yours. You know the importance of developing rapport with your athletes, with your colleagues, and that we have this role of being able to do our work is going to be more accessible when we have that rapport, when we have that trust and respect from the individuals that we're working with. But it's always a good reminder to come back to that. And maybe sometimes if there are things that aren't working, check in with the rapport. Is there something that needs to be repaired there? And then listening for change talk, that idea of someone's thinking about changing a behavior is something to latch onto and help call that out. So we'll talk a little bit more about that as well. So now what does the athlete bring? So the athlete, regardless of their athletic ability, them as the individual, they do have a vision, they do have goals, they do have values, they do have strengths, and truly they are the experts in themselves. I like to tell the individuals that I work with, you live with yourself 24/7, 365 days out of the year, times the number of years you've been alive. You are an expert in yourself. And that is important to sometimes remind them, to help them remember and know that they can trust themselves. And that's part of the process of learning that trust and being able to call that out, especially when it comes to changing behaviors. Respecting their vision, their goals, and their values, asking them about what those are, learning about them can certainly be helpful, whether they're related to nutrition or not. This can give you insight to the individual that you're working with, and respecting that is always important. Now, the strengths piece, we've told you we're going to talk about this. And this is something where having tools to help identify their strengths can be really helpful. So this via survey, and we have the link at the end in the resources, so you can check that out if you haven't done it before. I really do encourage you to do this for yourself. It's a great exercise to go to. I redid it recently for this presentation, and it's interesting to see how your perspective on some of the questions. It's basically an inventory survey that classifies different strengths and characteristics. And having an athlete or someone that you're working with complete this, whether it be in a one-on-one session, it takes approximately 10 minutes. They could pull it up on their phone or do it right there on a computer, or having them complete it beforehand and then being prepared to talk about it at an initial meeting. Maybe something we're not used to bringing in when we're thinking, oh, a nutrition consult, we're going to take an inventory on their nutrition, what have they been eating? That's what we've been trained to do. But bringing this piece in can really give insight on the behavior change aspect. And then you have concrete things to talk to them about and ask them questions about, ask them what their thoughts are on it, and it gives them a talking point and a place to elaborate on, again, to give you more insight on their process and where those strengths can be used to help them with changing behaviors. So now looking at motivational interviewing. So the definition here is that it's a collaborative goal-oriented style of communication with particular attention to the language of change. It is designed to strengthen personal motivation for and commitment to a specific goal by eliciting and exploring the person's own reason for change within an atmosphere of acceptance and compassion. So long definition there. It was established about 30 years ago in the area of addiction, but it has evolved to being used in many different areas because we know changing behaviors isn't just related to addiction treatment. It happens in many things that we do and with the individuals that we work with. I like this reminder listed below here that we can't make people change, only they can. And I think we know that intrinsically. When we think about it, that makes sense. Everyone is in control of themselves. But again, going back to the environments within an athletic culture, oftentimes there's this idea that others can make athletes change, that we have the power to do that. And I think it's important to take that step back and to realize the individual has that power. We need to respect that, but we certainly can support, we can facilitate, and we can guide that process in a way that's going to ultimately help them be more successful long term. So here's a review of the trans-theoretical model of change. Chances are we've all seen this in a psychology course, and perhaps some of you even have more training around this. But what I like is that this is it's a model that is flexible, and while it appears to be linear, you can certainly go back and forth, and it's a very dynamic situation that an individual may travel through depending on their situation. So some examples here in terms of what pre-contemplation may look like. If an athlete is in your office or you're talking with them in a training table or situation, they may sit down and say to you, my coach told me I had to come see you. I don't know why, they just told me I have to come see you, so I'm here. I'm doing it, my coach said so. So no real thoughts around changing, maybe a lot of resistance coming up. And so in this stage, that's going to be really hard to start with goal setting and moving forward. So it's helpful to have this insight of, okay, an athlete is in pre-contemplation. That can dictate how you may approach them. In this situation, it may more just be around exploring, asking questions. Why do you think your coach asked you to come see me? Do you have any questions? It could be an area for education, starting to prompt that process. Now, when they get to contemplation, this is where they may say something like, so eating breakfast may help my performance, but I don't have the time. So they're thinking about it. Maybe there's a thought there, but there's also this hesitation due to their lack of time. Now, preparation is when someone is starting to think, okay, you know what? I'm going to wake up at 7 a.m. to allow enough time to get to breakfast. This is the plan that I might put in place to start doing this whole breakfast thing that people are talking about. Now, the action is when they actually do it. That makes sense. They've done it. I went to breakfast in the morning. Now, maintenance, and this is where that intrinsic motivation may start to appear. They start going to breakfast every day. What the research shows is that this maintenance is really after 6 months of doing a certain behavior. So this can take some time, takes that time, that practice for it to become more automatic. Again, going back to brushing your teeth, it probably wasn't after the first time you brushed your teeth in your life that you were set to do it every day. And there still may be setbacks. So same thing with an athlete going to breakfast every day. They may all of a sudden something comes up, final exams, a stressful term like we've all been through. I'm sure there were some breakfast skipped over the last week. So there are certain situations that may disrupt that. But again, a reminder that this is a flexible, fluid model. So just because someone steps back doesn't mean they can't get back to that maintenance. But if they're back in action or they're back in preparation, then your strategy to support them, it might be a little bit different. So if someone falls from maintenance and they're back to preparation, then it's a reviewing of, okay, what worked for you before? Is that going to work now? Do we need to change the plan to adjust to the situation? And that's normal. That's part of the process. So when we look at the spirit of motivational interviewing, here are the highlights. If you decide after this presentation, or perhaps some of you already have, to dive deeper, you'll see that these can be expanded upon, and there's some other components. These are the ones that we pulled out as a starting point, again, building that framework as being the more important priorities. So there's that autonomy again, the accurate empathy, partnership, affirmation, and evocation. All right, so I'm going to jump right into poll question number 3. So if we can put that up for you to think about. Now, this is going to be looking at your strengths, and you'll see a list of categories that the VIA survey lists as the categories of the strengths. The survey has 24 different strengths, and then they're categorized into 6 categories. Actually, we have 5 listed here just due to the limitations of the questions. But I'd love for you just to look at those. Each of them have examples of what strengths fall into those categories, and select what comes to the top of your mind as your current strength. All right, and Fred, if you could share those.
Yeah, so wisdom looks like 28%. Courage, also 28%. Humanity was listed twice, which is 40% when you total it up, and temperance was 6%. So again, this is sort of skewed because we're missing a couple of categories there, but you know, again, great for people to start thinking about strengths and how strengths can be leveraged and how you can use strengths to kind of achieve compliance, how to you know, gain rapport, etc. So back to you, Stacy.
All right, so thank you for selecting those and reflecting on that. So with empathy, the definition that I like is respecting understanding of another person's experience, including their feelings, needs, and desires. And this comes from our wellness coaching manual. You may see some other definitions out there, but it's really about understanding where that person is, not necessarily knowing exactly. You may not know exactly what they're going through. Most often you're not. We're all in our own journeys, and I think that needs to be respected. But you can still come to it from a place of understanding. And you can use that understanding to then guide that process of change. This empathy on both sides, you can get an idea of where someone's coming from their body language and tone. You can also convey empathy in that way as well. It's really about listening and then reflecting what you hear. And sometimes it comes down to honoring silence in that moment. When someone talks about something being hard, that often has room for silence. Just let that hardness be felt. Can be uncomfortable, but that silence can offer a sense of empathy. Different things that you can say, especially, if someone is struggling, going back to the breakfast example, if they're struggling they don't feel like they have time to get breakfast, they may share with you all that is going on in their day and their life, and just giving them that empathy of, that sounds like it's so hard for you right now. That honest recognition of what they're doing is hard, and that they're doing their best, but letting them know that you've heard that. And then from there, again, bringing in that strengths piece. If you have an idea of their strengths and you've been working with them on that, you can switch and use that as a pivot point to say, how can you use your strengths to get to where you want to be? And that starts to open things up around that change. Autonomy is important, and this may be one of the most counter to what they've experienced. A lot of them may have gotten to where they are because they did everything someone told them. And now you're putting them in a position to involve them in their decisions, provide them with real choice, even turning to them and saying, what do you think is the best to do? I've had experiences where I asked this to athletes, and they're almost stunned. Like, why are you asking me? So it can be an awkward transition, but it's helpful to support them in listening to themselves and providing their insight. A lot of times they have great ideas in terms of what is a way that they can solve this problem. They're just not used to expressing them. It can reduce pressure on both parts. It reduces pressure on us as the practitioner to have all the answers. That's a lot of pressure. None of us can be an expert in everything. And really, we need to help that collaboration and being able to help the athlete be an expert in themselves and tune into that. And it takes that athlete perspective into account. So some asking permission is one great way to provide autonomy, and saying something like, if they don't have an idea of what to do, asking them, would you like to brainstorm around what this may look like? And so then it brings that collaboration piece, but it's respecting whether or not they want to engage in that process. So similarly, this type of environment can increase the need satisfaction and increases well-being. So the athlete feels like their needs are being met, they're more satisfied, they have greater well-being, and then can help to produce more positive behaviors moving forward. So here's that partnership piece that is, again, that rapport, and you can use that highlighting of their strengths, and it allows the athlete to lead themselves and take ownerships of the behavior, and you as a sports dietitian are guiding the process. So it really is that partnership. It's not telling the athlete like, hey, you're on your own, you figure it out. It's more saying, okay, what do you feel is best for you right now? What ideas do you have? And then providing your guidance, providing your expertise where it fits. But it's this collaborative effort that feels so much better than more of the telling the individual what to do. This affirmation piece, I think, is really important. Oftentimes we are confronted with, okay, what can you do better, or what is wrong with the situation and how can we fix it. And this really comes down to often celebrating small wins. I had a client that I was working with recently, and she has been completely overwhelmed with moving and COVID-19 and riots and protests and lots of real things happening right now. And she was putting herself down for the fact that, saying, I just don't have the motivation to work out right now. I just don't have, it's just not there. And I let her know that you are doing a lot right now. Look at all the things you are doing. Let's celebrate those. So it's about celebrating those small wins. And it was interesting when she stopped and said, are you just telling me that to make me feel better, or is that really true? So I think that shows where it's hard. We live in a world where we are constantly faced with what we are not doing, and it can be hard to see all that we are. And after breaking down everything she was doing and the energy she was exerting for those things, it made sense why getting up early in the morning to do a workout was really hard for her right now. And so reframing some of these things can provide that confidence boost. Again, coming back to what are your strengths that you can latch onto right now? Those still exist, and how can you use them? What positive attributes are things that you are doing? And this is really an empowerment, respecting the individual for where they are in the process, and validating that it's okay if you can't do something right now. What is it that you are doing, and how can you build on that and use that as a foundation moving forward? And it does provide that encouragement, and encouragement can look different for different individuals. Some individuals really respond to that cheerleader approach and really giving the support and encouragement. Others just want to know that they're on the right track, and would rather not have more of that cheerleading effect. So that can also be a conversation of asking what type of affirmation feels best for the individual, and getting curious around that can also help. So this evocation is really about listening, and this is where that listening for change talk comes in. So I think of this also like what you might experience or hear a news reporter in terms of their interviewing. So a lot of times news reporters will ask specific questions to get whoever they're interviewing to respond in a certain way or to provide certain information. And somewhat that's what you're doing with athletes. You're being strategic and curious on how to get more information from them, to then be able to use that information to propel them forward in a direction that they've identified they want to go. So one example of a question is, how could this change make your life better? If you have an athlete that is in contemplation or that preparation stage, having them really explore what part of this change that they want to make is going to make their life better, so that they're listening to them self-talk about this behavior and what this change looks like. We know if people talk about their changes, they're more likely to make them, they're more likely to commit to them. And this can also identify and respond to ambivalence, again, in that pre and contemplation stage of where does that ambivalence lie, going back to the example of an athlete wants to eat breakfast, but they just don't have the time. It doesn't fit into the schedule. So that ambivalence around their time demands, helping them to dig deeper in that. Another example, I know breakfast is important, but I'm afraid of gaining weight. So here's an example where you may be able to provide some education. You may be able to ask about what is it about the fear of gaining weight? What is it about breakfast specifically that makes you think it's going to gain weight, even though you see it's important? So you can ask those questions, and then you learn where they're coming from, their perspective, and then you're able to keep working with that. And then when you hear that change talk, that idea of, I know when breakfast is important, there's that idea around they want to change. So asking them and reflecting, I hear you say that breakfast is important. Can you tell me more about that? And then that gives that opportunity for them to keep talking about this idea of changing. And then there oftentimes is silence needed for that space to process. It always feels longer than it really is. When I've allowed for silence, sometimes I'll count, and really it's 10 seconds, maybe less, before the athlete will start talking. It feels much longer. So know that is important part of the process to allow for the thinking, allow for the thought process to happen. So finally, really, this is the idea of bridging a great divide. There is a divide that I think we need to recognize, but Fred and I both provide this as an invitation for you to change your culture, whether whatever environment you are in. I like this idea Fred shared with me in some of his trainings, that we're so often in athletics, we see wins and losses, and that is what games and competitions are classified as. But in this situation, it's really about winning and learning. So motivation to change is fluid. It's not a straight line. It's going to change as the individual evolves as a human and on their journey. It's going to be influenced by a lot of different things, whether it be outside events, nature of the world, nature of that individual's life, and what they're going through. So it is a fluid, and we need to respect that as well. I encourage you to generate momentum for change within your ability. Sometimes it can feel really daunting, even for myself, in the practice that I've evolved and learned more about. There are times where it feels like, oh, this seems right, I can do this. And then there are other times where using this skill can be more challenging. So sometimes it's about taking a step back and looking at what's realistic for you in that moment, and knowing that other opportunities will evolve over time. With the idea around building, Fred shared some of what they're doing at Oregon State right now in terms of collaborating with other departments and even coaches. So there's an opportunity perhaps to see if coaches are interested in this. If you have additional expertise, could you extend that to the coaching environment? Maybe an interesting switch. We're talking to sport coaches about coaching in a slightly different way to enhance their sport coaching. Might feel like an interesting role for you to play, but I think, again, it comes back to that partnership. The other area that this can be really key is helping to approach when you're working with coaches, rather than coming in and saying, this is what I can do for you, which may have a role in some ways, but maybe starting off with, what challenge do you have as a coach, and where do you see myself as the sports dietitian helping for you to solve that problem? Put it on them, give them the information, or give them the opportunity to share with you where they're coming from. And then you can insert, here's what I could do to help you solve that problem based off of your expertise and your ability and resources, whatever that might be. This helps to build that trust and rapport. And again, we all know if we can trust and have that rapport, things are going to go a lot better down the line. So that's such an important piece. I encourage you to practice these skills. They do take time. It's really a lifetime of practice. Like I said, I'm continuing to practice these, continuing to do trainings and working with them in different realms, and it's always evolving. And the other piece, probably no surprise to any of you that are listening right now, but specifically with athletes, there's more research that definitely needs to be needed. There's limited research. When I went to look for this, went to Fred and I were working on this presentation, there's a lot of research, like I said, in addiction or in behavior change and psychology, in weight loss and the general population. But when it comes to athletes specifically, these approaches and research around it is lacking. Now, obviously, there's a lot of factors that go into that, but if any of you have connections to be able to collaborate with research units at the universities that you're working at, and within the environments that you're in, I think there's a lot of opportunities to adapt these approaches specifically to athletic environments that have different needs than, say, your heart health patients, or again, the addiction field where this has come from. So a lot of opportunities to shift. It is counter to the culture that many of athletics are based on, but I think there's room to grow and certainly to generate change in a positive way so that everyone can benefit. So here are some resources if you're looking to get started or want more. So the motivational interviewing book that we mentioned, it's a big one. It's pretty heavy, but I think it's a good resource. It does give that foundation. It's something that you can always go back to. And then I really like this motivational interviewing in nutrition and fitness. Dawn Clifford is a registered dietitian, and brings that approach and that mindset to the way she presents the information in this book. And then the strength survey we talked about, there's the link right there. It's a free survey that you can use. There's also additional resources on that website that might be helpful to the work that you're doing. All right, and with that, there are references, and we are open to taking questions.
Thank you all both so much. Let's go ahead and start off with, we got time for a couple of questions. So we'll start off with the first one. How do you suggest using this approach when a sport coach, or strength coach or athletic trainer wants you to use a more authoritative approach, because that's what they think typically works best?
Great question. So this is something that I think we may all encounter. If you haven't encountered this in your career as a sports dietitian working with coaches, you have a great environment that you're in, but I think that's a natural part of the work that you're doing, to have that questioning from a coach who may be more on the side of this authoritative, let's just tell the athletes what to eat, what to do, and that's the answer. I think this has a couple different opportunities where you can, again, if you've established that rapport with the coach, that can be key, but also letting them know that I've met with the athlete. We are working on a variety of different strategies. Right now, the athlete is in a place where education is best. We've done some education. We're going to follow up. Here's the plan. There will be a follow-up plan, and we're working in the process. Obviously, there's a need to protect health, privacy, and that information, so you can always fall back on that, especially that as that is in the department that you're working on, of how much you can share with the coach. But I think it's important to let them know that the process from your area of expertise and looking at that change takes different time for different individuals, and you're engaging in that way. Fred, do you have anything to add to that?
Yeah, I just might say, it's like, activate your curiosity and say, Coach, why do you feel like, or athletic trainer, why do you feel the authoritarian place or position is going to be the best for this? And then allow them to lay it out there why. And then I think once you kind of hear their perspective, to be able to kind of talk through the behavior change, that all the things you just said, that they're saying pre-contemplation, and that education is the best thing for right now, but it's an ongoing process. It's not a one and done.
Mm-hmm.
Okay, a few more questions. So what would you tell an athlete if they insist on having a meal plan as opposed to making small changes over time?
That's a great question too. And definitely have encountered that a lot. Oftentimes what I will ask for is, what do you see this meal plan providing for you? And sometimes I'll even say, I'm happy to provide that plan for you, but let me get a better idea of what you're looking for. What would a meal plan provide? It's someone that I was working with recently that said that, just tell me, could you just provide me with the recipes? Could you provide me with the foods to eat throughout the week? And so I prefaced it as, what would this provide for you? And he wanted structure. He wanted the accountability of eating those things that I was recommending. And then I also highlighted that, let me learn more about what you're looking for, because there's the other piece of this is, know that it's going to involve preparation, and we have to think about what's realistic for you. So how much do you want to prepare? How much do you want to what types of foods do you like? And you are the one that's in control of that. In this situation, this individual also mentioned that they liked variety. And so I talked about how on the one hand, I called out that discrepancy that you've told me that you really like variety in your foods, but you're asking me for a plan that is going to be the same or similar week to week. How does that fit with your need for variety? So really finding what that plan's going to provide for them, and then and putting it back on them. How do they see a plan aligning with what they're looking for, and is that realistic for them to maintain long term, especially if their goals are something that's going to take a while to achieve and it's a work in progress.
So we'll make this the last question. How can you use these strategies effectively when you only have a small window of time to work with an athlete? So such as a contract dietitian, maybe on campus intermittently, how would you handle this then?
I love that question because that's like that ties back to the research piece, because most often sports dietitians, athletic trainers, we don't have the luxury of an hour-long consultation to sit down and talk through all these things with people. Most of the time, athletes don't want that either. They're on the go. They have a lot of things to do as well. I think you can do this in small doses. Fred, would you mind, you've done some great job in, especially on the athletic training front, when you're only interacting with athletes in treatment situations or brief periods. Can you share some of your areas where you've implemented that when you don't have that time to sit down with an athlete?
Well, I think there's probably some key things that even within a short window, you can kind of get a lay of the land of where they are on the continuum of pre-contemplation to, really wanting to make that change. Clearly, the autonomy piece should ring loud and clear within medicine. You're seeing more and more of, here's your diagnosis. What would you like to do about it? And not, mandating. So I think it's easy to kind of, that's the low hanging fruit to kind of apply to perhaps a dietitian that's got a really short window with people, is how that autonomy, but create that vision. Those are all things that don't really take a lot of time, that I think you can kind of set the stage for behavior change and ultimately success.
Yeah, just asking those open-ended questions too in your interactions. And I think that's where there's lots of opportunities to do this creatively within athletic environments where time is limited. It's always going to be limited and always going to be a challenge to manage around that. But getting creative, starting with one question at a time, and even in situations where you may be at a training table or meal or even a fueling station, talking to athletes as they are making choices or taking fueling options. Hey, why did you choose that today? What made you think about choosing that recovery snack versus this one? And you can start digging in to get that insight from the athlete, and then bringing that back, reminding of things that they may say. I think even those small doses may actually have greater meaning than, say, a longer session.
All right. So thank you both, Fred and Stacy, for your time today and for your presentation and your wealth of knowledge. That's all the time we have for today. So thanks so much for joining us today. And thank you to our premier partners, Cheribund, for sponsoring this session. We hope you found this information useful. We'll post a recording of this call to our webinar library on sportsrd.org. Thank you so much for attending, and have a great day.
Thank you.
Thank you.